Have you ever wondered what a day in the life of a surgeon might look like? Well, as you can see, it starts pretty early. Yes, I guess it is winter, so it is still dark. But by and large, you do start the day quite early. And today I'm starting the day with an operating session. So first things first, once I'm in the hospital, I'll go to the ward and see my patients. And then I'll go back down to theatre and meet the rest of the team, where we will talk about the list in more detail. 1A, 1A. So before every single case, we always read through the notes again. We re-familiarise ourselves with the case. We check the pathology reports, the MDT outcome. We go through the imaging, mammogram, ultrasound scan, MRI, CTs pertaining to the case. And after each operation, we also make sure we document the surgery and file it away in the notes for our records. Surgery done. Next thing I need to do now is see post-ops. So let's go onto the ward, make sure everything's okay. Post-surgery, they would have gone to recovery, and after recovery, they go to the ward. And hopefully they'll be able to go home later, if everything's okay. So first half of the day is done. I had a few cases to do today. Our first patient required a mastectomy. She had a rather large cancer compared to the size of her breast, so she needed a mastectomy. She declined any form of reconstruction, so she has gone flat. And at the same time, I needed to remove a few glands from the armpit, so she had a mastectomy and a sentinel lymph node biopsy. The second case had a smaller cancer, so I was able to remove the cancer as a lumpectomy. So she was able to keep the rest of the breast. So I did a lumpectomy. The cancer was very, very small, actually was not particularly palpable because it was found on her mammogram. So she had a wire put in the morning, and then she came to theatre and I removed the cancer, obviously with the wire as well. And like the previous patient, she also had a few glands from her armpit removed. So both patients were fine post-surgery, had a normal clinical examination. They were both feeling very, very well and no nausea, no pain. So they should be able to go home later on today. So now I am going to go and have lunch. And so I haven't seen a friend of mine who actually lives abroad, so we're going to catch up. Now I'm going back to hospital to do my afternoon clinic. Some patients to see, and need to get out of this rain. So in the breast clinic, I work together with a breast care nurse as well as a breast radiologist. And together we work as a team in order to provide care for our patients. So that's my clinic done. Now, what happens during a breast clinic? Well, during a breast clinic, it can vary actually. It can be a mix of seeing new patients as well as patients who are returning, so follow-up patients. The new patients are essentially patients with new symptoms. They would have been referred by their GP, or some of them actually self-refer, and they will come to see me with a breast problem. I will examine them, and then they will get imaging, so an ultrasound scan, a mammogram, either one or both. If they need a biopsy, then they will have it at the same time, and then come back to see me, following that, for me to discuss their results. If the scans are normal, then that's it. They can go home, hopefully feeling reassured. If we do a biopsy, then they will have to come back about a week later for me to give them their results. During the clinic, I also see other patients. So these are patients who either have had surgeries, so post-op patients, where I will give them the results of their surgery and also examine them, make sure everything's all right, and then formulate an ongoing treatment plan. So if somebody has had a cancer operation, they may need further treatment, such as radiotherapy or chemotherapy. So I will talk about those areas with them. I will also see patients who are coming back for the results of their biopsies. So patients who, say for example, I saw today, or last week rather, they had a biopsy last week. So today, a week later, I'll be giving them the results of those biopsies and talk about them. So that it was what my day was like. And I do get asked, what do surgeons do? And I say, actually, our days can vary from one day to the next. We do have a set routine. In other words, we know what we're doing day after day, but within those days, the activities can vary. So, for example, my operating session will vary in terms of the cases that I do, and the clinics can vary depending on the types of patients that I see. So it is extremely variable, and that's one of the great things about being a surgeon. Your day is never the same from one day to the next. So I hope you have enjoyed this day of the life, and I'll see you in the next one. Take care.